Next, we're going to look at Chapter 17 and discuss oral medications. Keep in mind that you'll need to become familiar with a variety of solid medications, but most commonly those will be capsules, tablets, enteric-coated capsules. These are medications that make it all the way through the body, through the stomach, into the small intestine. They're specially encapsulated or coated, so they're not absorbed while in the stomach. But this is a math class, not a pharmacology class, so let's move forward. You'll also be given sublingual, that means under the tongue, or buccal, that means in the cheek, so you'll bite something and maybe press it up against the cheek. We also have extended release, and we have scored tablets. This line right here means that the pill can be broken in half. We call that line a score. This would be an example of what we would call a pill cutter. There's a sharp, tiny razor, and that will split the pill on the score line, and then you would have 2 tablets broken in half. Some medications must be given in whole, meaning that they cannot be broken, cut in half, or crushed. These medications would be enteric-coated and sustained release. Because if you split an enteric-coated capsule in half, then half of the medication would be enteric-coated and the other side would not. The cut side would not. Sustained release is an example, or SR. Sometimes medications will be followed by the abbreviation SR, that means sustained release or slow release. You would not want to cut these pills either, but we'll discuss more of these principles in pharmacology. Medications have trade names and generic names. I would recommend that you learn both while you're in nursing school. Whenever you see Tylenol, you would just say Tylenol or acetaminophen. And that way it'll help you learn, because some prescribers will use the word Tylenol while others will use the word acetaminophen, and it's the exact same medication. You'll also need to be able to read labels in order to interpret the dosage strength, the composition within the tablets, and other instructions to keep the medications and your patients safe. As discussed in class, many oral liquids or oral medications may come in a liquid format only or in a liquid format as an alternative. Some clients may not be able to swallow a pill, or they may have difficulties chewing, etc. So we may reach for an oral liquid medication. Those orders will be written with the words elixir, suspension, or syrups. They may be given by mouth, PO, or through a nasogastric or NG tube. Never, ever should these be injectable or given through an intravenous route. Just because it's measured in milliliters does not mean it can be given via the intravenous or IV. It should never, ever, and I do repeat, and I star, ever be given in an injectable intravenous route. Again, liquid medications need to be measured in milliliters, and they're measured using cups or droppers or syringes. Quite often at home, clients will be instructed to use teaspoons or tablespoons, and as discussed in class, we know how many milliliters would fall in a teaspoon and how many milliliters would fall in a tablespoon. So based on your health teaching, you would be able to assess whether or not the client understood that you taught them correctly and that they're administering their medication safely. Key points to remember. Pause the screen and read each one of these carefully. Please take a moment to complete the following questions, 42 through 55 on page 314 in your calculation textbook. Please remember to practice each of the steps and check your answers. The answers are provided. All you need to do is take the time, set up the equation, and double check that you're doing it correctly to know that you're going to pass the math test without any problems. Hopefully you found this review somewhat helpful. Please watch it over if there's any areas that you're struggling with. Practice the questions that were outlined in the original PowerPoint. And if you have any questions, please remember you can post these on the discussion board. Thanks and have a great day. Looking forward to seeing you next class. With any skill, like math, the more you practice, the easier it becomes.